welcome to you on to our guest. Thank you for attending here and being part of our WellWaveNOW session. Why that's a good lead-in, because I always like to make sure we introduce quickly our esteemed colleagues. And Breck, as we just talked to, is very much in the community wellness and delivery of that through pharmacy and other entities as the chairman of a company called Bryn Health. And then he's been involved with the pharmacies for a long time and helping them be independent ones be effective and work with communities through his company that he co-founded at ServeRx. And then it wouldn't be the same without Dr. Bob Levine here. Bob is a renowned brain researcher and a leading authority and expert in non-pharmaceutical pain management. And part of that world he honed as the director of the Henry Ford System Center for Integrated Health there. We also have Mike Hayes with us, who's beside there. And you can have a good message, but if you can't get it out, you can't promote it, and you can't get it adopted and heard and received, then it's not as effective and doesn't have the impact one wants. And that's what Mike does for us. Mike is the holder of and the recipient of 2 Peabody Awards for journalism and has a long, illustrious history of working in broadcast journalism and in other areas to really have an impact on society and getting messages out that in order to transform and help others with that. I'm Tim Daniels, a wellness plan manager with 17 years of focus on wellness. And now wellness plan management, I look to be a trailblazer in that world. I believe it's needed, and I believe others aren't doing it. Simple terms, but not to belabor analogy. Think of it like you have a financial manager that helps you put in place your financial plans and actions and resources to make things happen. I think there's a need for wellness plan management to do that on the wellness side for individuals and help them achieve the optimal wellness and live fitly productive lives well into their golden years. And it was really part of my work in running a home care agency across 3 states for 8 years that really got me on that path. Well, I knew people could get better, and I knew could they live regardless of age, regardless of live better for longer. So that's what brings us together here, is to make that to try and make that happen as a group. And as part of that work that we do, we like to have these discussions with people in terms of topics we think they can be informed on, that are free to them, that hopefully gives. So we all have offerings, products, advice, and services that we like to deliver and sell to consumers and help them with. But we also we see ourselves as having a duty and a requirement to provide advice out there to help others in any way we can. That's part of our service here. We like to give things and discuss things that people can put into practical use and move forward on with that. And so we've got this series now on take charge, how to lead, and why, how, and what to lead in your healthcare world. This is series part 2 in it. Part 1, if you've got a desire to learn about that, go ahead and put that in the chat, and we can actually get you a copy of the part 1 that went actually we're about an hour with the discussion. We like to go about 30 minutes here. If you've got questions, please put those in the chat. We'll try to get those towards the second part of that 30 minutes. But then we stick around to have an interactive conversation for another half hour for anyone who likes to do so with us. So today, as part of that, what we want to really talk about is effective communication. One of the most crucial things, because we don't replace any healthcare provider, and we like to collaborate with healthcare providers and help people in that collaboration. And that's one of the key things: is what do you communicate with your healthcare providers? How do you communicate with them? How do you get ready to communicate with them? So that's our topic for the day. As part of this, Bob, so I'll put it in your hands. I know you've got some great thoughts on that.
Well, I think it's really important that patients who are going to see their healthcare providers, whether it's a physician or a nurse practitioner, physical therapist, even pharmacists, it's really important that people understand that they have power to communicate effectively. And a lot of people think that their physician is like the on a pedestal, knows everything. A lot of people are intimidated by their healthcare professionals in terms of communication. And that's not a very effective way to approach the interactions. It's really important for people, as our title says, take charge and ask appropriate questions. And if they don't understand something, get the explanations from the providers, because otherwise people are left wondering, they're left worried about things. They don't know all the details. And these practitioners are experts at relating the information because they have the knowledge base in their mind. So we just have to pull it out of them. They don't know what we know. They don't know what the patient knows. And so
Mhm.
not always do they deliver all the information because they think that everybody should sort of know this stuff. And that's not exactly how it works. So
Mhm.
people need to remember that the most important thing in my view is to be confident in your ability to ask any questions and ask for explanations about anything you don't understand. Being confident is one of the most important ways of being to express and implement when you're going into these conversations with the healthcare practitioners of any kind, whatever, whether it's a conventional care practitioner or whether it's a so-called alternative non-insurance covered care practitioner. So I'll leave it there for now.
Yeah, but I want to come back to that being confident, but I also want to chat with Breck here a little bit in one area. And this is a little drill down there, Breck. I know you feel free to comment about other parts of it, but one of the things that you're known for is really understanding and getting people to understand their medications and the interactions and things of that nature. And it might be self apparent, but I'm not based upon my home care days and helping the elderly look at their medication and talk to providers. It's not always the case. It is well known, but take meaning like to understand from you your perspective on what somebody should know about their medications, how they should talk with their providers about it, things of that nature.
Yeah, it's very vital that they know exactly everything that you are currently have been prescribed. So, quite often you go to a primary care provider, but then you get referred out to a specialist, or maybe you just skip the primary care and go right directly to a specialist now and then, and so they're not connected. They both need to know what you may be prescribed or what you're using, and it also counts the OTCs. No one has that on record, only you do. So your OTC meaning over the counter. So I just recently had a visit with a doctor, and I actually took a picture of the over the counter eye
Mhm.
drop that I was using
Mhm.
because I wanted to make sure that he knew exactly what I was using to try to get some itchy eye relief from, and opened up my phone and showed him the picture of the Bosch product that I was using. So it's very
Yeah.
important to have as much detail as you can, and that means that you have to do a little preparation beforehand. You got to go
Mhm.
look in your medicine cabinet and actually write down, make a list of all the different things that you may be taking, whether it's a prescription or not.
Good. And so what was your provider's reaction when you took that in, Breck?
Yeah, it was like, oh yeah, that's I can see that's a good product for itchy eye. We're still going to write you a prescription for this because I
Mhm.
unfortunately had contracted conjunctivitis from my grandson,
Yeah,
right? So yeah, even though that's viral, they still have an antibiotic that you use to try to clear up some of the problem that was going on in there. I don't want to get graphic, but it was gory.
that's right. Yeah, but I think your thing, more and more I find, especially with the integrative ones, and especially I think with some of the top systems, they do ask about supplementation and other things, but that's not always the case in certain things. And it is true that things like if you're taking even a multivitamin, things like calcium and other things can affect what happens with you in terms of your medication. So it's key to really drive that home and emphasize that. I agree with you on that one. So, Dr. Bob, back to you a little bit on one part. You say, it's good to have that confidence in there. So, yeah, and so that's I think that's part of what you work on with people and as you work with them. How do you get that confidence? What's the
Oh,
research?
wow. Are
What do
you
you do with
serious? It's a tough
that?
one. Well, okay. So, well, first of all, I think what Breck said about preparation, I think that preparation is key. So, any questions that somebody has I would write them down for sure. And whether you're being confident or being concerned or worried, that you can still look at your piece of paper or whatever, your phone, and you can see the questions you have. And you want to make sure those questions get asked and they get answered. That's really the key. But people can tell, if they're being confident or they're being, let's say, afraid. That would be somebody's afraid to interact with an authority figure like a physician, let's say, or anybody who they see as an authority figure. that they can feel that, they can tell that. And so I teach people how to shift their expression of being, that they're the way of being they're expressing. Like, when they can tell it, I give them steps on how to do that. But the most important thing is to be prepared, because that helps. That helps people have confidence that they can get the answers that they need. And
Right.
also the other point we wanted to talk about, I think, that we should talk about, is just doing the research. Checking out what's known about this in both the conventional care arena and the alternative care arena. And there are all kinds of different websites. Maybe Tim, you want to comment on this in terms of the research aspects of what people
Sure.
should.
I think and I think there's so much in that area, Bob, in terms of general things. So let's think about it as we were talking about a little bit at one point, and Brooke and I have talked about it as well. You take a look at the blood tests you can get and they give you on that. And whether most times they might call you back for a telehealth visit to talk to whether you may be going in the office on that. I think there are sites out there like the Mayo, top-notch like the Mayo Clinic and others that will take you through exactly which every one of those tests are. I think it's important to understand what those tests are and what they're about and what's in there to be able to, as part of the preparation. I think that gets back to being an informed consumer and sometimes helping to guide the conversation. Why have you given me this test? What are you looking for here? Because then now you can talk about your symptoms and that thing from that nature. That same thing. So so I think you also one site I think you like, Bob, and that mentioned is like Green MD. So, but you can go to place the Mayo Clinic, Green MD, beautiful thing, PubMed.gov, that is actually a resource for many doctors, has the gold standard studies up there, double blind, peer review, placebo control. So if a doctor was recommending a certain therapy to me or a certain approach, I'd try to go up there and see what's really been up on there to have the conversation with them. And I'll take you down that path a little bit on that one, why it was key. Sometimes the doctors are looking for an indication of your tolerance level and how much you want to undertake and how much you want to push and are you ready for it. Why can I say that? The recent incident had a discussion with the doctor about whether or not to undergo a PET scan for something. This was in Austria. This was in my case. But as we talked through it, so it had a CT scan, it had an MRI, it had biopsies. They said, well, the only thing else we could do on this is the PET scan. Well, so I had a discussion with said, take me through this PET scan. How's it differ with it? And it says, well, and part of what that discussion came out with is that I would be exposed to a lot of radiation because they put enough in there to really light yourself up. And it's the type of radiation, I think it's called ionizing radiation, that could actually potentially cause some damage to the tissues. I said, well, if you find this thing and you find that, what will we do about this now at this point anyway? He said, nothing. He said, exactly my point. But if I'd have said, hey, to your point, put him up on a pedestal and taking it to mean you want to give me this test, doc, let's go down that path. He would have given me that test. But that's the resource of understanding the questioning. One has to have in a position to do it.
That's always, in my opinion, the best question to ask.
Yeah.
What are we going to learn from this that's going to change the treatment plan? And if the answer is, well, nothing, then hey, why are we doing it?
That's right.
Sorry to interrupt you, Tim.
No, that's quite all right. Good interruption point there. Appreciate that.
And maybe Brett can talk about some of the research into drug metabolism and the fact that I love the work that you're doing, Brett, in terms of helping people understand that they may be taking a drug that they can't even break down and doesn't work for them at all. It's crazy, right?
Yeah, it is. It's a little concerning when you just believe that everything's supposed to work for you, right? And in a perfect world, it would. But everyone's genetic makeup is so different that it's truly important to understand what you can properly metabolize and what you don't metabolize. And the other thing too that we haven't discussed yet is being an honest patient. You go through the questions in advance. Are you a smoker? Well, occasionally. You need to put that down. Or do you drink alcohol? Do you are you taking anything else? And maybe if you're not in a state that's legalized certain medicinal purposes. You've got to be honest about that. And providers are completely open. They're not going to rat you out. They just need to know what you might possibly be taking into your system. So I think honestly, being honest and open with your provider is very helpful too.
What do you guys think about second and third opinions, let's say?
Well, love them, and I think you also have to sometimes push for that. And I've had clients, do that as well. And sometimes it might just be, and let me go. I'll go even a little bit upstream from that, Bob, on the second opinion. When I always encourage people, and I do this myself, whenever my primary person, I trust her and I rely on her, and I think she's very good. But when she refers me to a specialist, I research that specialist. It's very easy online now to find where were they educated, where they do their residency, are they published, etc. And that what are the ratings that their patients are giving them. I go in with all that information, and I will still go to the ones you mentioned. But then I also said, okay, well, fine, and encourage people. They say, well, if this is very complex, well, this guy's a regional specialist. Maybe you need to get into the Sloan Kettering system, the Stanford system, the Mayo system that specializes in that for your second opinion. So one, I think second opinions from level of comfort, from level of expertise on there, and also it's like anything. When I used to get my house, I've now downsized and live in a nice little condo here. When I used to get my house painted, I'd get 3 estimates to compare and say, what's the complexity of this? What's going on here? What's this real job about? When I used to run IT services practices, I do several estimates. So I think estimates, opinions, I think they're wonderful. Brett, in seconds.
Yeah, I think it's always good to get a second opinion, because you're going to have a different experience of number of patients that they've dealt with that particular situation that you're in. So if you especially if you're doing anything that requires a procedure, you want to make sure that provider has had successful outcomes multiple times, that it's that is something that's second nature to them. So you don't just go with the first opinion, because it may be a little more aggressive than you need to go. And that's where functional medicine comes in, right? You might actually look at looking at a more holistic approach to dealing with something first, to see if you can't get results that way, versus going directly to some type of a procedure, whether or not you're being completely put under or not, because there's just as much risk, right, to the anesthetic as there is to the actual procedure itself. So you got to take all things into consideration. You can look at what those statistics are and what the outcomes are. In orthopedics, you find out that there's a really high percentage of the number of surgeries that are performed in orthopedics, that the outcome is not any better than what you were dealing with beforehand. So
right.
You need to be very cognizant of that.
And that gets into a little directive question that was put into our chat, which is, what happens if you disagree with the treatment plan? So continue down that path a little bit, Breck. When you say, if you given the orthopedic outcomes, what would you do, or what do you recommend, and if someone says, if the doctor says, here's your surgery XYZ plan, and you disagree with that, what would you recommend be done?
Yeah, well, I mean, obviously be super respectful, right, to the opinion that you're getting from that provider. That they've in most cases have a lot more education than I do anyway. I'll speak for myself, and more experience. But if you look at the statistically the outcomes, and whether you're going to be better off with that outcome than just living with the issue. There's obviously exceptions to every rule. I got personally, I got the opinion from ER doctors at, Vel Ski Resort that, I'd probably be fine. I could just probably cast up my ankle and it could heal up just fine on its own, but get an opinion when you get back to your
Mhm.
orthopedic surgeon at, back home. Get back home and first x-rays didn't really look all that bad. But then something was a little bit out of whack, and so they took some more imaging and then realized that no, everything was totally out of
Mhm.
whack. So you do need those extra opinions every once in a while. I mean, when the tibia had completely broken off and slammed into your malleolus and knocked it out of place, yeah, it's not gonna find its way just naturally back into place, um, and those bones aren't going to match up again without a little bit of surgery. But that was the extreme, right? But there are a lot of surgeries that do happen, and then someone says, "Man, I still, now not only do I still have the same, you know, pain or problems, but now I also have some nerve damage in that area." Because that was all part of the surgical procedure that some nerves were severed.
Right. Yep, that's part of it. Yep, yep, go ahead, Bob.
Well, we're talking about surgeries, and I'm flashing back on surgeries like crazy here in my mind. One of my areas of expertise is chronic back pain relief, elimination of chronic back pain using natural drug-free therapies. And one of the things that when people read about back surgery, for instance, they're going to find something called failed back surgery syndrome, which is a very strange name for a condition when a surgeon operates on a patient on their back and the surgery doesn't work to eliminate the pain. The patient has failed the back surgery. I mean, and so I don't get that name, failed back surgery syndrome. So people need to watch out for uh, names that are applied to things where it's not their issue, it's not their fault. And so that's one thing. And then the other thing I wanted to point out is we did a surgery years ago when I was at Henry Ford Health System directing the Center for Integrative Wellness. Um, an ACL reconstructive surgery on a patient who had
Mhm.
received no general or no spinal anesthesia. We did it all
Wow.
with electroacupuncture and
Mhm.
hypnotherapy. It was pretty wild, and the patient made it through. They were awake the whole time. We had an anesthesiologist standing by to provide anesthesia if needed. It was not needed, so it was it was a surgical first, and we captured that on national TV as well, which is kind of cool. But the reason I bring that up is because there's all kinds of things in the alternative
Mhm.
non-insurance covered arena that people may want to investigate if they have the resources to find ways of helping themselves. And it really requires digging and scratching around, looking for all kinds of information. I'll leave
Right.
it there.
That's right. And that's the same thing. That's what triggered when you were talking. That's what triggered off in my mind. For example, um, doctors, while they try to stay current, they do various things. We can't expect them to know. It gets back to your earlier statement. Don't necessarily put them up on a complete pedestal and treat them like uh, the deity to beat all deities out there. They're humans, and just as you went through. Here's somebody, and as Brett talked about, the risk of general versus other types of anesthesia. Here you were able to have a plan of approach where a person didn't need that. Normally, they may not have thought about that. That's the type of discussions. If you disagree with the treatment plan, you need to feel that's not, it's, you can feel, even if you're afraid to, even if you're not confident in doing so, which you would love one to be, you got to give yourself the motivation in terms of this is my health, this is my life. I need to understand this. I need to guide this to be able to ask those questions to see what else is out there. And I'll give just two quick instances of that. Take one, had a woman here in the past 2 months who had broken, as is not uncommon, the fifth metatarsal bone in the foot as they aged and osteoporosis was set in. 8 weeks, no healing. Her primary had referred her over to a surgeon, said, all we can do is put a pin in that foot on that one. Somehow she heard about me and one of the technologies, that I apply with pulse electromagnetic field therapy, and was first approved to speed the healing of bone fractures that weren't responding. 4 weeks of use of that, X-ray, manual, confirmation, totally healed on that. Her doctor didn't know about it. If she hadn't questioned that treatment plan, etc. Same thing. Had another woman with osteoporosis, and they were looking to put her on the medication and do that. I said, well, why don't you have a discussion of what level you're at in this now? What's your doctor think about resistance training? What does your doctor think about these calcium supplement and this to do that at this point? She went back and had that discussion, and the doctor said, sometimes I don't, just like so many people look for the magic pill. The doctor was kind of saying, I was trying to give you the magic pill, but yes, if you can undertake this stuff at your stage where it's not really into osteopenia at this point, you indeed could benefit from that. So she was able to go down that path and not have to take any medication on that. So I think it's extremely key, whether if you can get the confidence, great, but get the research, motivate yourself by saying, this is my life. I've got to undertake it, and you just got to have that interesting conversation with your, and that's what it is. I'm going to have a conversation with this doctor to understand how he or she wants to work with me and do so.
So Tim, there's a question in the chat here, and we should open it up to questions here since we've already blown through this half hour so quickly. Time passes so quickly, but what if the patient does not know how to research their condition? Where do they go? What are some ideas for that? We talked already about PubMed having some really good studies. You've got, I like the Mayo's site too. I think they do a wonderful, fabulous job. I use it quite often for drug-drug interactions because they're very thorough on that. What are some other? WebMD obviously is one that people go to.
I think if people are able to go online, there are support groups for just about everything, every condition out there. And I think joining a support group is really valuable because people can realize they're not alone in their situation, and they can learn from other people. Like, what did you try? What worked for you? What worked for this person or that person? So I would say support groups are really big.
Yeah, I think that's great. And that also goes hand in hand with, we talked about how to better communicate with your medical providers. Bringing a support person with you to that appointment is also very good, right? Because they'll remember questions to ask certain questions you may have forgotten.
Right.
Yeah, they'll also go ahead, Tim.
So along those 2 points. So one is some of our people listening, let's say if you have a language barrier, man, you can have the right in many places, and I'd look to your health provider to ask for someone who can translate and come along. So that's one. But number two, both the other part of that, just as you could pick a family member or some friend to go along and understand things with. And if you don't know how to research, there's also similar to that, there's a profession, which I didn't really know about until I got into the home care business. There's a profession called patient advocates. Many of them operate for free, are government funded by your town, by your county, and things of that nature. Yeah, I think you can still call I haven't dialed 411 in a long time, but I think you can still dial 411 and say patient advocacy or Department of Social Services to start with. And you can find
Tim, you're really showing your age here, Tim.
Well, what I hope, Bob, is that yes, I'm giving indication of my age by speaking that way, but because of the great advice I get from you and Breck and take for myself, that I am looking like a spring chicken still. There you go.
There you go.
Bob, he was on the management side. He wasn't a resident at home. But one last point that I'll make about advocacy for yourself is not all is lost if you get done with the appointment and you forgot to ask something really important. Follow up. Yeah. Even if you can't speak with the doctor, their admin, their the physician assistant is really great, very knowledgeable, and will gladly follow up with you. Also, another resource would be your local community pharmacists. Those PharmDs, those doctors are the most trusted health advisor in the world for the last 10 years standing. They know a lot.
Yeah, I was about to say, do you think they warrant that trust, Breck? Why do they warrant that trust in your opinion?
But for a couple of reasons, obviously not just their knowledge, but they're accessible. They're happy to help you.
Yeah.
You may not get the same experience from a big, national chain where it's just just a hired employee there. But if you go to an independent, they are very hands-on. They're very willing. I mean, you ask where to find something, 9 times out of 10, they could be busier than ever, and they'll leave their workstation, walk out, and walk you out to the OTC product that you're asking for. I mean, they're very accessible, so that's why I think
And, yeah,
patients can access them easier.
and they can also provide resources. Like if you ask them to look up something, figure out something for you, they'll do that. They'll get back to you, but they'll do that. And I think that's why I love those PharmDs because they're such a great resource, and they know their drugs. They know pharmacology more than any mostly more than any physician, and mostly more than any drug rep. I mean, they really know what's going on.
Yeah,
So
you probably had a few more courses in pharmacology for your PhD, but one semester versus 4 years of pharmacology is what you're looking at. So most MDs have one semester,
yeah,
and a PharmD is literally 4 years of just been digging into all
yeah.
of the how the chemicals all come together and combine, and then what effects they have on the body's own production of chemicals. I mean, it's like there's some things that are automatic, like every time you get a certain kind of med, you also better get a supplement to go along with that because that med is leaching that out of your body.
Right.
Yeah.
And one thing I'll add, and Bob, I'm gonna put you on the spot this week and let you kind of summarize the salient points after I do this one. But one thing what I have found over my life, I was talking with Bob earlier and said, when I first really started looking at this, even though I was in the high tech world, was when I was 29 and my father had a big stroke. And yes, I had older siblings, but I had to kind of, and I was very tight with him, so I kind of took the lead in his care and looking at it. And I had one doctor turn to me at one point and said, "Are you a doctor?" But that's and so at 29 years old, that's the basic level of research somebody can get into and get to that level. And by this was a very good doctor asking me if I was on because of that level of interaction. But so that's one point. But the other point I really wanted to make on that was if the doctor is good, they're excited about the interaction with you because they're really out for your health. They're really out for a good outcome. They are very caring people, almost as I deal with them on other business aspects, almost to a fault because they say, I'm not a business person, I'm a doctor. They love a knowledgeable patient interacting with them. I almost going to step on where I want Bob to go, but like Breck, well, I'll leave still summarize. Like Breck said, being honest, that's honest with them, and does good research. But aside from that, Bob, I'm gonna leave it up to you to kind of wrap it up with what
Matt, you think
she said.
it helped me to warn me that I was going to have to wrap up?
Hey, all I'll say about that though, Tim, real quick before Dr. Bob winds us up here, and also if anyone has any questions, please put them in the chat there. We'd love to respond to them.
Right.
But know that medicine is it's a medical practice, right? There's nothing that is absolute, and so the more involved you are in being your own advocate helps you get a little closer to what is needed, and you don't just become someone that's practiced on.
Yeah, most physicians that I've spoken with over the years would all say that most of conventional medicine is about 30% proven through research and about 70% not so proven. And so that means that when you're going to see your physicians, they're doing the best they can with the information that they have. So that's why it's always good to do your own research so you can come up with different scenarios that you can ask the physician to respond to. And they may be able to, and they may not. And on the physician's part, they need to be able to say, I really don't know anything about that, and it's not my area of expertise, and just let it go at that because there's no point in not getting pissed off because they don't know. They were trained a certain way. There's a lot of information out there in so many different areas. So to wrap us up, Tim, I would say we talked about how it's really important in terms of communication with your healthcare providers that you if you are able to, be confident, and if not, be prepared. Have your questions ready. Make sure they all get asked. We talked about bringing along a patient advocate. Maybe it's somebody in your family, so they can have your list of questions too, and they can make sure that you're asking those questions. We talked about doing research. The different websites you can look up, all kinds of different things. You can even go to YouTube and see if you can find some videos on it. And let's see what else. How am I doing so far, guys?
Beautiful.
Great.
Okay. And if there's anything you want to throw in there in terms of summarizing, please do so. We talked about the importance of taking advantage of the pharmacists, the doctors of pharmacy, and any pharmacist really is trained to really know about the pharmaceuticals, the pharmaceutical interactions that are really important, and read labels. Read all the instructions about how to use everything, what the potential side effects are. Don't always buy into the side effects. They have to mention side effect after side effect after side effect. Those are oftentimes small, really low percentages. You want to, when you read that stuff, my recommendation is you say, well, that's really something that has happened to everybody else, but I'm free of all that. That's not happening for me. I'm free of all that. Anyway, that's just my last tip, which we didn't cover, so I thought I'd cover it now.
Well, I agree with that one, but we all three have our spiritual discussions too, and that just falls in line with my religious beliefs. And sometimes you got the authority to rebuke things off your body, and you rebuke those side effects. So absolutely.
Right.
So and that God, so I believe in evidence-based medicine research, but I also believe in some faith-based medicine too.
There are a lot of great clinical trials that have been done showing the power of prayer in certain instances, which is quite valuable to support healing, and even remote intercessory prayer, which is people in one location praying distantly for another.
Absolutely.
Some really interesting double-blind, placebo-controlled trials showing the effectiveness of that. So it really depends on the condition, depends on the circumstance, but it is there, and so you have to acknowledge that.
All right, appreciate it. So I thank you and Breck. Honored to be with you as always, and happy and thank the guests for being with us. We're still around. If any of you guests have any questions for us, open it up and feel free to ask anything that you'd like.
Yeah, and if you haven't yet, save the chat. There's some good information in the chat. I also included the part 1 of this series, the what, why, and how to lead in your own health and wellness journey. So
Hey,
that
Breck,
link
did you put that free? Did you put that free?
I did not. Thank you.
Maybe you want to say
remind me about
just
that.
something about that.
Right.
Yeah, so I'll put this in there real quick for you. It's this is all about longevity. This is a way to add and basically a whole 8 to 10 years to your life. So if you want to add 8 or 10 more years to your life, please take this health risk assessment, and if
Breck,
you can answer all the questions correctly, then great. If not, then you probably need to speak with one of us.
there you go. Hey, Breck and Tim, there's Mike, if Mike's still with us. There's a comment in the chat about, I believe that placebo has cured more than anything else. And I go along with that. I'll go further and say that placebo is an essential component of healing in general.
Absolutely.
With few exceptions. So in other words, the placebo response, which I equate to belief that the result that you want will happen, right, is essential for healing. And because anybody can reject anything, they can say, no, I do not believe, I don't have faith in this, and it can't possibly work for me, which is a lot of people think that, like, I can't possibly get out of pain. I can't possibly be free of stress. I can't possibly sleep well at night because it's been going on for decade after decade. So the point is the placebo, which is simply, in my view, the future vision that healing will occur, and they know it's going to happen. Deep faith in that, and that's what placebo is, and I think it's an essential component to healing.
Absolutely.
Yeah, absolutely.
Right.
Dr. Bob and I have had that discussion about starting our own pharmaceutical company that just only produces placebos, because you literally can get as much efficacy than some blockbuster medication that's had millions and millions of dollars of research put into it. lot of power in the mind.
And it's a whopping 10% better than placebo.
Right. Yep. And then the other part of that, I gotta take, and I respectful of everybody's religious beliefs and where they come from, where they're at on that. Yeah, for me, when I take the Christian religious belief and put it in there, it adds even more power to that placebo, because the belief there is, number one, you have a God, an entity that wants you well. And then a second part of that Trinity that has made provision for you to be well. And so now it's accepting it. And then looking at it and saying that that healing is there for you at whatever level of faith you have. If it's without the medication or surgery, and you really have that feeling, boom, it can happen. If it's at the level of, guide this doctor, make this I believe this medication is going to work, you'll be met at that level. Absolutely.
Yeah, I've always maintained that it would be great to develop a communication program for healthcare providers and physicians who are prescribing the drugs to really. I always wondered about drug holidays too. That's another important thing patients want to be aware of. You know, you take a drug for a while, and every day is a new day, and every day we're a new person. So at some point, it may be possible to get off the medication. So with the right partnership between the healthcare provider, the doctor, and the patient, the doctor can wean a person off to try the drug holiday if it's not life-threatening, and see what happens when the patient gets off the drug, and see if they can maintain their more normal physiological profile without the drug. So drug holidays are like a forgotten, they're forgotten, you know, completely. And I think that that's a big mistake in conventional care.
Yeah.
Yep.
So Brecken, I'm gonna find this comment, because I know it wasn't directed at me. Maury was buttering you and Breck up on this comment. And I want to thank him. After that, he also said, this was great and interesting, guys. Thanks for sharing good information. So, well, I think you two hit the objective.
Thanks, Maury. Appreciate
Because
it.
I have come to know, and you two already know, that Maury is a very informed and knowledgeable consumer. So if to him it's for those of you who can't see the screen, he's kind of doing a little maybe not, but we know he's being humble out there. Very knowledgeable and informed consumer. So if it's been to the level where it's been of interest to him, then I think we've hit the mark, guys.
Definitely.
Yeah.
Well, it's great to be here with you, Tim, Breck, and Mike. I don't know if Mike's still here. Mike.
No, Mike.
Okay, yeah. So anyway, it's great to be with you guys, and I'm looking forward to next week what we're going to discuss.
All right.
Yep.
Yep. The next week, yeah, that'll be part 3 of our discussion here on how you take charge for your health, the who, the what, why, and how to take charge of your health, and we'll go a little more detail.